Good afternoon. Thank you so much for joining us. My name is Tomas Talamonte, Deputy Chief of Staff to Mayor Bowser, and we thank you for being on our Community Leader call. You're going to hear shortly from Dr. Nesbitt, our Director of the D.C. Department of Health. We also have with us today Christopher Rodriguez, Director of the Homeland Security and Emergency Management Office, Dr. Smith, Director of our Department of Forensic Sciences, John Falchicchio, our Chief of Staff and Acting Deputy Mayor for Planning and Economic Development, and Deputy Mayor Paul Kine, who is our Deputy Mayor for Education. And you'll hear from all of them shortly, and we'll be here to answer your questions as well. And just a reminder, if you are in front of a device, if you could please, or a laptop, if you could please visit coronavirus.dc.gov. We will be reviewing that tool. We're also joined by our Assistant City Administrator, Jay Melder, our Director of Community Affairs, Lamont Akins, our Director of the Office of Community Relations, Julia Irving, our Director of Nightlife and Culture, Sean Townsend, and our Director of Religious Affairs, Thomas Bowen, and our Director of Talent and Appointments, Steve Walker. So, again, thank you all for joining us. We'll be here to answer your questions, but to get us started, I'm going to kick it over to our Director of Health, Dr. Nesbitt.
Good afternoon, everyone, and thank you for joining us today for this important update on the district's posture and response as it relates to COVID-19. We thank you all for your time and your assistance with our responses in the district. We have had a all-community response to COVID-19. To date, we have 10 cases of COVID-19 in the District of Columbia. 2 of the cases we have not been able to identify their exposure to the virus, which is indicative of community transmission. One of the other factors related to COVID-19 in the district has been the fact that across the region, some of the cases in Maryland and Virginia have had an identified exposure in the district. As a result of that, over the past week, we have taken a number of steps that are related to community mitigation when you have evidence of community transmission that have required us to implement strategies related to social distancing. Our initial steps were related to the recommendation for mass gatherings that now has been implemented as a prohibition or ban on mass gatherings, implemented as a regulation or rulemaking effective yesterday for the restriction of mass gatherings of 250 people or more. And if an event is for individuals who are part of the at-risk population, those gatherings should not have more than 10 people and should be canceled. We also have a number of social distancing measures that have been in place, and there are other individuals on the call who can give you the details of those, but those social distancing measures include telework for district government employees, as well as social distancing and distance learning opportunities for our DC students. We have been very deliberative in how the social distancing policies are being implemented. We have a commitment to continuing providing essential services while this is underway, including the provision of meals to people in our community who rely on us for that, such as our students and seniors, as well as providing essential services in the government related to public safety, public works, and some of the other essential services in some of our district government agencies. The purpose of our social distancing efforts are to be able to reduce the amount of person-to-person or social interactions that we have in our community that would allow for the transmission of the virus. And so our employees will still be working while we implement our telework policies. So being in contact with the constituencies that they serve, and our students will still be learning while we are implementing these policies. So they are not designed for people to not be in their physical work environments that they typically are in, and our students to not be in the schools we do not want activities to occur in the community that are designed for them to congregate in other places. So it is not the opportunity to host social, cultural, and entertainment options throughout the community with the assumption that people need things to do. The mayor mentioned yesterday that we are using all of the assets we have available, such as our TV station, et cetera, to be able to provide other opportunities for people because we do have concerns as to what confinement may cause for people from that perspective, but we want to be mindful that we have the impact of our social distancing policies and efforts such that they can have the intended effect of slowing the transmission of the virus. So I'll stop there and allow for questions when the lines are open.
Thank you, Dr. Nesbitt. We'll now hear from our Chief of Staff and Acting Deputy Mayor for Planning and Economic Development, John Falchicchio.
Thanks, Tomas, and thank you, Dr. Nesbitt, as well. So we're going to open it up for questions in a moment. The way that you get in the queue for questions is to press 0, so please do that now. Just wanted to go through the coronavirus.dc.gov. Hopefully you have an opportunity to be in front of a laptop or a mobile device now that you can pull up coronavirus.dc.gov. But this tool is where we're placing all of the latest information we have about how to protect yourselves, your families, and key information to share with neighbors. And so if you're on that page right now, you'll see the home page is kind of just a general welcome of keep up to date on the coronavirus within the D.C. area. And if you look at the top, there's several options. The home page, what is COVID-19, information for healthcare providers, coronavirus data, resources, and news. For the purpose of this call, we're going to focus on the resources page, and on the resources page is what we call our Coronavirus Resources Toolkit. And on that page right now, you should see, if you refresh your browser and click on resources, that you'll see resources for the public, resources for business, resources for kids, for schools, faith organizations, and then we also have a lot of these resources in multiple languages, as well as the ways to stay connected. So for the purpose of this call, we have convened community leaders across a broad spectrum of constituencies in order to make sure that they have the latest information. And because you're community leaders, we want to have you share this information with your networks on social media, in the neighborhood, and through email sends as well. So all of the Coronavirus Resources Toolkit can be downloaded and shared. You can also be sure to refer folks to coronavirus.dc.gov as a way to get that information out. And so as Mayor Bowser said, we're all in this together, and we'll all get through this together. So what we really need is right now to share that information that is best based on the best guidance that Dr. Nesbitt is drawing upon after reviewing what the CDC makes available to all of us. And so we can open it up to questions. Tomas is going to kind of walk us through that, but really we can't stress enough how much it means if you share with your networks coronavirus.dc.gov. One thing that you'll see by tomorrow, because I know there will be questions about kind of the district's operating status and our posture. And so what we're going to do by tomorrow is have a tab, an additional tab across the top next to news, and it's going to say what's open. That what's open will tell you agency by agency how you can interact with D.C. government and which service centers will be open and which will have adjusted service. So by tomorrow, we'll have up on the site what's open, and the what's open tab will be the one that shows you how you can interact with district government in terms of direct service providing. So with that, I want to open it up to questions, and Tomas is going to moderate that for us.
All right. We'll go to our first question here. We have Commissioner Brannon. Commissioner Brannon, you're live.
Hello. Yes. My question concerns the meeting schedules for this period for A and C commissions, since they're not able to meet by, my understanding on the law, by teleconference and must be in person? Should they be postponed until this period is ended?
So we'll ask Dr. Nesbitt to just give a walkthrough of kind of the best guidance that we have based on the medical information available.
I'm sorry. We are asking that all entities and organizations give great consideration in terms of their needs to meet. During a declared emergency, entities have the ability to revisit their meeting schedules and conduct business in a way that is different. If you have a need to have a change to the law, bringing that to our attention sooner than later is helpful, so that you could potentially conduct business virtually or have a suspension of your agenda. We know that many people who attend ANC meetings and civic association meetings would fall under the category of persons greater than 60, individuals who have serious medical conditions, or persons who are otherwise immunocompromised. And so we would not want to have a conflicting message of continuing to host those types of meetings, creating a potential pressure point for them making a decision to continue engage in the governance of our government and making the decisions to comply with best practices in public health.
Great. Thank you, Dr. Nesbitt. And again, I know a lot of our commissioners have that question, so we're going to be working with the Office of the ANC to get that guidance out to you all soon as well. Next, we'll go to Jeff Trammell. Jeff, you are live.
Hi, this is Jeff Trammell. First of all, I want to commend Dr. Nesbitt and the mayor and the whole team, because I know everyone in the district appreciates this aggressiveness and this leadership. A concern I have is that while this great work is being done, I'm afraid it's being undermined by continued social life in the bars in D.C. If you saw the news last night, there were many interviews with young people on U Street saying that this won't affect me, or I'll get over it if I have it, or I really just don't care, and they're congregating. So while these sacrifices are being made by the schools and the parents, we have it all being undermined at that level. And, of course, these same people then go to the drugstores and the grocery stores where it's essential that everyone else in the district goes. It affects all of us. So I don't know what can be done about that, but I think that is our great vulnerability right now.
And so we definitely, Commissioner, understand the sentiment, and it is something that we're mindful of, and we are continually sharing the best guidance that we have from the Department of Health, so that everybody can protect themselves. And it's incumbent, as you mentioned, upon all of us to make sure that we do practice social distancing and make sure that we follow that best medical guidance that we have. So we'll continue to work with our partners in the small business community to make sure that they have all the information for continuing their operations, but doing so in the safest manner. And so we'll make sure that we continue to do that. Some of the resources that are actually on coronavirus.dc.gov actually list out for folks some of the guidance that we have, as well as we have it down to, and we've had this on the site before. I'll make sure. We have guidance about preparing workplaces for COVID-19, because we know some businesses will need to continue to operate, and so that information is available within the resources page of coronavirus.dc.gov.
Great. I know we have a question from Miss Oliver, Darlene Oliver in Ward 5. You are live.
Yes. My name is Darlene Oliver. I'm commissioner in 5CO5, and a lot of my residents are dependent on food stamps. Now, here it's the middle of the month, and they're stretching what they have left. So now they have to add an extra meal, a morning meal, a breakfast, and a lunch to what they already have. Are there feeding centers that are going to open up possibly to help these families? Thank you.
Thank you. We'll actually have our Deputy Mayor for Education, Paul Kine, update on feeding sites. Deputy Mayor, go ahead.
Yes, thanks so much. This is Paul Kine. We have stood up or are standing up a number of feeding locations around the city to ensure that our students who rely on school lunch for their daily meals will continue to have access to food over the course of the school closures. That full list is available on the website. We've got feeding locations around the city with the idea that these students, either DCPS or public charter school students, will be able to go to pick up prepackaged, in many instances, non-perishable food items for themselves. And as I said, this is intended to support the ability of these students to get food over the course of the school closures.
Thank you, Deputy Mayor. And I know as well the Department of Aging and Community Living, their senior meal sites will continue to operate through this period, where there'll be our senior residents that are participating in the program will be able to pick up their meals from their standard sites. So that'll be continuing as well. Next, we're going to go to a question from Commissioner Hamilton in ANC 6D06. Commissioner Hamilton, you're live.
Hello, and I also want to applaud the efforts of Director Nesbitt and the mayor and everything that you all are doing to make sure that we react to this crisis. My question is I have a lot of constituents that are not on email. They don't have readily access to email. How do I get information out to them, and are there paper copies available that we can also distribute to the residents, because it's a concern, because they don't know a lot of this information because they aren't able to log onto the website?
So we're getting, that's a great question, and so we're getting more of the printed materials, and we're going to have some updates on how we get that out. We'll probably have the MOCRs reach out to the ANC commissioners about how we can get the printed materials out to you. So Julia Irving, Director Irving, is here with us, and she'll make sure that the MOCRs have some more information about that on Monday when we expect the printed materials to arrive. But that's a great question, and we definitely want to thank you for your help in advance to get that information to folks who might not be able to get onto the internet.
Yeah, and Commissioner, we also have a mailing that's going to be going out to the community as well next week, and so we'll have 2 mail pieces about prevention and additional information that'll be hitting mailboxes next week as well.
And Tomas, will that be primarily targeted to the seniors?
That's correct. It'll be primarily targeted at our senior population. All righty. We'll go to our next question from okay, great. We'll go next to our next question, Commissioner Alkine in ANC 6A. Commissioner, you're alive.
Hey, this is Brian Alcorn. I'm Commissioner for ANC 6A08. Eastern High School is in my single-member district. I'd like to ask about the logistics for the Meals for Students, as both person-to-person and environmental transmission of COVID-19 are concerns. I have a couple of concerns. First, wondering if there are any environmental health considerations being put in place at the feeding sites to be maintained and monitored. Second, I'm just wondering how the locations will be staffed, if they're by DC employees or volunteers. And then third, will ID be required by students or their families coming to pick up the meals? Thanks.
Thank you. This is Deputy Mayor Paul Kine again. On the logistics, we are still conferring with the Department of Health on the best possible way to ensure safety both for the workers and for the students. Right now, we're considering, first of all, scheduling of grade bands as much as possible. We're certainly looking at ways to queue people with distance between them as they do their pickups. We're working on the way in which we'll be able to do this using tables that are outside the centers, so people will not have to actually enter inside the centers to pick up their food, including the use of tents. So all of that is under development in coordination with the Department of Health to ensure safety. You also asked about ID, and we are actually not going to be asking for ID at pickup. And then thirdly, you asked about staffing. Currently, we are anticipating that these sites will be staffed by DC employees and not by volunteers.
Thank you, Deputy Mayor. We're going to go to our next question, and just a reminder for everybody, again, if you have any questions, you can press 0 to get into our question queue. And apologies if I mispronounce your last name. We're going to go to Larry Janez. Larry, you are live.
This is Larry Jenzik. I'm a journalist. I have a news blog called Capitol Hill Corner, and I'm pushing information about the coronavirus outbreak into my constituents and readers. My question is this. The Governor of Maryland has declared an emergency open season for enrollment in the Affordable Care Act, and will D.C. follow suit?
We can get that information to you. I don't know if Dr. Nesbitt has that latest information. I know that HBX did post some information late yesterday about their posture. So if you give us a moment, unless Dr. Nesbitt, you have anything on it, we can look at latest information that they posted up and share that before the end of the call. So
no, they have not made any definitive decisions. They have been very aggressive in terms of looking at the coverage and reaching out to ensure that the health plans that are on the exchange have no copays or don't charge for any related coronavirus care. It is important to recognize that there is no that no one will lose coverage during the time because of a lack of a missed payment or anything like that. So there will be no penalties from any of the health plans that are on the exchange during the emergency. So those types of things have already been decisions have already been made. There are some differences in terms of the coverage in Maryland and the coverage in D.C., but, John, yes, you can look up the exact actions that they have taken, so I make sure I haven't missed anything.
Yeah, we'll do that, Dr. Nesbitt, and try to share that before the end of the call. The other note we should make is that, one of the reasons we're so resilient is we actually do have a really large number of residents who are insured. In fact, we're second in the nation in terms of insurance coverage for our residents. So that's something we're excited about. And we'll see if we could find any information on their social media and then share that before the end of the call. If not, we'll make sure we get that information out or post it on coronavirus.dc.gov. So we'll go back to Tomas for the next question.
Thank you, John. Our next question is Mr. Reginald Black. You are live.
Yes, I was wondering, Reginald Black. I actually work with homeless people. So I was wondering what limits on gatherings are there, and what are we defining as like a social gathering? And then the other question is, what is going to be the response to people who are in shelters and people who may be living outside?
And we'll go to Dr. Nesbitt for that, first one and second.
So, and the official rulemaking is available on the website. So if you want the actual language, to be able to have for your records, so I'd encourage you to go there with all of the definitions that we have for mass gathering. It's the limit on people is 250. There are some exceptions. We don't consider public or private schools, transit, office space, hotels, or residential buildings, grocery stores, shopping malls, retail establishments, hospitals, and medical facilities are not included as well. We also, for example, we have given guidance to the food retail establishment community that restaurants who may have an occupancy above 250 would not fall into this as a mass gathering because individuals dine in small groups. However, a banquet area in a restaurant where everyone is gathered into a single large room and are standing around and interacting with each other without being at arm's length would be an area of concern. Movie theaters where there are multiple sections and rooms in the movie theater where each theater that has less than 250 seats, again, would not be considered to be a mass gathering. We do consider the shelter environment to be residential, and there's opportunities to section off if in some of our shelter environments that everyone is not in a group of 250 or more in those particular environments. And we have been working very closely with Department of Human Services as they have interacted and had conversations with their partners around the shelter environment and with the Department of General Services to establish, consistent with CDC recommendations and guidelines, ways to reduce spread in shelter environments for people experiencing homelessness.
Thank you, Dr. Nesbitt. And just wanted to give an update on the question about getting enrolled. So from the DC HealthLink Twitter handle, there was a tweet on March 12th at 5:10 p.m., and I'll just read it. It says, if you are a DC resident and worried about COVID-19 because you need to #GetCovered, DCHealthLink.com, so that's DCHealthLink.com, has a special enrollment period so that someone without insurance can get covered now. If you live in the district and are uninsured, and I'll give this number, you can call 855-532-5465, and they'll help you get covered. So we'll put this information in the resources section of the coronavirus.dc.gov just so you can share it with neighbors.
Thank you, John. And Moker is at your service. We do, Commissioner Hamilton, we do have some booklets on their way to you. But Mokers, again, will begin to distribute, but just wanted to give an update to everybody following along. We do have some booklets on the way to Commissioner, so other ANC commissioners will get those en route to you as well in the coming days. So let's go to Commissioner Guggemos. Commissioner, ANC 2F, you're alive.
Thank you. I was just wondering, if good pathology is based on percentage and patterns, how many samples are we actually running through a lab per day, and do we have a max capacity, or how many hours does it take to get it back? And obviously there was an assumption made to lower the mass gatherings from 1,000 to 250. Was just wondering what assumptions or predictions, again, since we can't base it on our test results, were used to make that determination.
So let's just go through. It's just on testing. I just want to make sure everybody is clear on the testing regimen right now. So for COVID-19 testing, doctors decide on COVID-19 testing. If an individual is experiencing symptoms including cough, fever, and shortness of breath, they should consult their doctor before visiting their doctor. If the doctor decides that a COVID-19 test is warranted, the doctor has the ability to take swabs and send it to a private lab for testing. The private lab will share results with the doctor, who will share the results with the individual. The private lab will also alert DC Health of all COVID-19 test results, regardless if a test is positive or negative. And so testing has now, private labs are now able to test, and so doctors have the ability to take the swabs that they need in order to do the testing that they need. Dr. Nesbitt, do you want to talk a little bit more about the mass gathering and anything I missed on testing?
Sure. I'll talk about the decision process. I do want to make sure that folks understand that our decision making is data driven, and we have had sufficient testing in the District of Columbia to drive our decision making. So I'm unclear as to the comment. In the district, we have had 2 individuals whose exposure is unknown, and so that allows us to be able to make a statement that we have community transmission in the District of Columbia. When you're looking at making decisions about needing to shift from containment, which means that we know where people are who have the virus, we know how they got the virus, either from a travel to a place where there is widespread community transmission, or that the person got the virus from being in close contact with someone else who had the virus. So when you still have that as being the only way that the virus is spreading in your community, you can remain in what's called containment. Once you have community transmission, great consideration should be given to shifting into community mitigation. Once you move into community mitigation, depending on how much community transmission you have, which means cases of unknown exposure, you make a decision as if you're moving in at a pace of minimal, moderate, or substantial community transmission. So the social distancing processes or interventions that we are putting in place are, from my perspective, indicative of us having a moderate level of community transmission. So how do I arrive at a decision that we have moderate community transmission? I'm not only counting the cases that are diagnosed in the District of Columbia. We live in a region with very porous borders. We have cases in the region that have been connected to the cases in the district. There are, as of yesterday, 39 cases in the district, and those 39 cases happened in a week's time. So because those 39 cases happened in a week's time, we are taking a very aggressive posture to have an aggressive community mitigation strategy such that we don't continue to have an exponential increase of cases in the district, in the DMV or National Capital Region. So it's not that we have a lack of data, it's that I have a visibility into being able to understand from a contact tracing perspective that one case in the district has led to 10 cases in the DMV area alone. And so not looking at just one case in isolation in the district, but how many other cases did that cause between the district and the National Capital Region. So it is a data-driven approach in terms of the interventions that we are making, including going from 1,000 mass gathering individuals in a mass gathering down to 250.
And we'll hear from Dr. Smith at the Department of Forensic Sciences as well.
Hi, this is Dr. Smith, Department of Forensic Sciences, and I just wanted to address very quickly our testing capability. And, right from the beginning, we've actually been able to handle the number of samples that have been provided to us, the number of patients. We have the proper capacity right now to handle. For one run, we can do 10 to 15 people. If we need to do 2 runs, we are able to do that. We, of course, are looking at higher processing systems. We had to wait for approvals of those and receipt of equipment, but for now we are able to meet the number of samples that are coming to us, and we are providing that data to DC Health with a 24-hour turnaround time.
Thank you, Dr. Smith. We'll go next to Ambrose Blaine in Ward 7. Ambrose, you are live.
Yes, thank you. First, I want to congratulate you, Dr. Nesbitt, and your team and the mayor for the information that you have thus far shared with us in terms of getting people to focus on their hygiene as well as a number of different things and what you all have done in terms of shutting down some of the systems. I have a couple of real quick questions. One is concerning the feeding sites. coupled with a reduced transportation, because there will be a number of residents that have to go take their transportation publicly to get to those feeding sites, and whether or not there are any plans concerning that. Second, residents in Ward 7 and 8, particularly that have compromised immune systems, which are also at risk other than elders, such as those with HIV or kidney disease, and what the Department of Health feels should be done or should plan for those. And then lastly, bed availability. In the event that a spike occurs, bed availability and the number of test kits that will be available.
Thank you, Ambrose. We'll actually go to Deputy Mayor Kine to address your question related to the meal sites. Deputy Mayor.
Thanks, Tomas. Yes, at this time we actually are not contemplating providing transportation to and from the meal sites. We're assuming that residents will use existing forms of travel to get there. In the event that we see some compromised travel across the city for our public transportation, we of course will revisit that question, but currently we're not contemplating providing transportation.
And Dr. Nesbitt, anything else on that question?
Yes, as for bed availability, we have been working very closely with the hospital CEOs, and a couple of weeks ago, we sent a letter to them to, prior to a couple of weeks ago, back in January, we have been in constant contact with them through the Health and Medical Coalition to ensure that they have been working with their COOP plans and looking at their medical surge needs. A couple of weeks ago, we made sure that they really fully understood the government's need and willingness to be flexible as it related to regulatory and licensure during this time, in the need that a public health emergency would be declared. I am pleased to say that they have definitely done those things, and even in conversations with one of the hospital CEOs yesterday, they were able to report that they have the capacity to ventilate over 100 patients in their healthcare facility if the need would arise. One of the hospitals has been able to identify a medical surge floor in their hospital that has not been occupied in over a year or two that could be reopened if we had medical surge needs. And we have even been in conversations with Providence in terms of whether or not that facility would need to be reactivated. And so, we really have a huge capacity in the district to reopen some healthcare facilities that have closed in recent time, as well as our healthcare leaders in the district have really been innovative in terms of reimagining how healthcare facilities could be used in the event of medical surge. Our biggest pressure point is the concept of testing and really getting people to recognize the stress that testing and people demanding testing who have no clinical indication for testing puts on our healthcare resources. And so many of our healthcare leaders really want us to be all on the same page about how the healthcare community, private physicians, primary care physicians really can access testing. As the Chief of Staff has already mentioned, is that testing is available in primary care practices. They can access testing in primary care practices. The physicians can swab you there, send those tests to private laboratories. Not everyone has to go to an emergency room to be tested. And as long as we continue to do that, we can be sure to ensure that our healthcare infrastructure remains intact in the District of Columbia.
Thank you, Dr. Nesbitt. We'll go next to Alicia Burke. Alicia, you are live. Alicia Burke, you are live.
Yes, hello. This is Alicia Burke with Rich Capital Concepts, calling from the Lee Drury Park, Ward 5 neighborhood of Washington, D.C. And two questions that we have. The first one is, are there any resiliency efforts already in place to assist residents in this time of crisis? What information can we get out to the community in addition to the coronavirus website? I think there's some type of aggregate sources, the feeding sites, the medical information, all in one that we can share with our neighborhoods and our residents here in the Bloomingdale-Leroy Park neighborhood, and also Ward 7, where we do our Veggie City Farmers Market. The second quick question is, does DC currently have some type of simulcast system where we can hear these emergency messages in real time in an instance, an occurrence such as the coronavirus or what we're facing right now? And if not, are there any efforts or funding or anything that can be put in place for nonprofits to implement that in the neighborhood so all the residents can get the message at the same time and be prepared adequately?
Thank you so much, Alicia. We'll go to our Director of Homeland Security and Emergency Management, Christopher Rodriguez. Director?
Thank you, Tomas. Thank you, Alicia, for the question, and good afternoon, everyone. Yes, so there are extensive resiliency efforts in place throughout the district. And I'll talk a little bit about your specific question on messaging and alerting. So in the mayor's order in terms of teleworking some aspects of DC government, the Homeland Security Emergency Management Agency has an essential function to disseminate public information in real time. And if you haven't already done so, and for those on the call, please sign up for Alert DC. And you can do that at alertdc.gov. And if there were any imminent public emergencies, we would disseminate information along that platform, and that would come to you via email and or text. We also have a variety of other tools at our disposal, which we have used as recently as a few months ago. The wireless emergency alert system, if in an imminent, threat to life and public safety, we'd be able to disseminate messaging pretty quickly. I would also refer you back to coronavirus.dc.gov, which again adds another layer of public information, and that is updated in real time constantly. And the Alert DC platform also is manned 24/7, 365. So those resiliency efforts for a public communication standpoint is in place.
So we want to thank everybody. Thank you, Director Rodriguez. We want to thank everybody for joining the call. We had several hundred people on the call and joining us, and the questions were really helpful as we continue to make sure that coronavirus.dc.gov has the information you need to talk to your neighbors and to help us spread information that can be helpful to them. We have updated the resources page while we were on the call, so that question about the special enrollment period from DC HealthLink is now on the resources page. And so we're going to keep updating it throughout the day. The other alert we wanted to make clear was that the What's Open page will be posted tomorrow on the site, and it'll have agencies by agency how you can interact with the government while we're in this telework, agency-specific telework model. And so we'll have that information up, and you'll be able to navigate which agencies have which service centers open and such. And so that's it for this call. We'll do these calls periodically when we have a major update about the district's operating posture, and we encourage you to continue to visit coronavirus.dc.gov for all of the latest as we update the site on a 24/7 basis.
All right. Thank you, John, and thank you, everybody, for joining us. And again, that is coronavirus.dc.gov. Thank you, and we appreciate you being on the call today.